The World Health Organization has claimed that over 47 lakh people lost their lives due to coronavirus infection in India. However, the centre has refuted these claims, questioning the credibility. Here's more.
Isn't the full story. The Indian government has come out strongly against the WHO, questioning the report at multiple levels. But if it's India's word against the WHO, let's ask some serious questions of the WHO, whose handling of the coronavirus plague has been a subplot to the global pandemic. Has the World Health Organization inspired confidence in its handling of the COVID pandemic, or has it been a global hypocrite, largely bending to certain clients? Like China, for instance, that reports no data whatsoever on COVID deaths and remains unquestioned by the WHO. WHO's claims on other countries fly blind when it comes to China, a nation that continues to hide the origin of the Wuhan virus till date. The WHO actually claims China's excess COVID deaths is amongst lowest in the world, a country that makes a mockery of its zero COVID policy by forcefully keeping its citizens under lockdown. When the world was suffering the first wave, China's COVID deaths suddenly disappeared from official reports after April 1st, 2020. China's COVID case count never went beyond 80,000 in the public domain, and the WHO never really made a noise about it. China has in fact continued to report thousands of new cases of COVID from April 1st, 2020 until January 8th, 2022. China officially counted 34,107 new COVID infections, including 12,000 in Hong Kong as per Johns Hopkins data. The University of Washington estimate put China's excess mortality at 17,900, including 10,600 from Hubei province, where the coronavirus was first detected 2 years ago. While the WHO report asks no questions of China, India is the only country to stand up to object to the claims.
That occurred after testing positive for COVID-19 were occurring in the first 4 weeks. So a cutoff of 30 days was given for the definition of death. So this is robust data that we have, and a robust definition that I think only NHS has used it in the UK, and we have used it. Many countries don't have this definition.
The data the WHO has used is more on hearsay evidence of what has been there in the media or from unconfirmed sources. That data itself is questionable, and to do a modeling on that data is not correct, and it's not scientifically a right thing to do. And especially when you have data which is more robust as far as the RGI data is concerned.
To apply assumptions based on a subset of states, based on reports that come from the websites and media reports, and then you come out with a exorbitant number is not tenable. So that's on the process, and we are disappointed by what WHO has done.
India has also presented its side of data collected. Earlier this week, the government released civil registration data showing 8.1 million deaths in 2020, a 6% rise over the previous year. Officials played it down, saying all the 4,74,806 excess deaths could not be attributed to COVID. According to official records, some 1,49,000 people died of COVID in India in 2020. While the China resorts to blatant human rights violation with its forced testing and vaccination, India carried out a smooth, voluntary vaccine drive, protecting more than 72% with one dose and more than 60% fully vaccinated. While China masters in data manipulation, WHO calls for better data monitoring from the world.
The WHO has repeatedly come under fire when it comes to questions surrounding China, but it refuses to learn from its past mistakes. An independent panel that was looking at the pandemic response said that China and the national health authorities there, along with WHO, failed to act in time in 2019, when the genesis of the coronavirus was first reported from Wuhan. China continues to hide data and does not reveal the true picture of the COVID burden in their country. But the World Health Organization preaches other nations on development and proper data upkeep. This is Milan Sharma reporting for India Today.